We're going to get right into it. All right. You guys ready? Yeah. All right. Let's do it.
Well, that's me right there. Daniel. You can call me Daniel, Dan.
Dude, who knows Dan? Who watches his videos? Come on, let's go. Come on.
Well, thank you. Now, the reason why I'm DanDanTheFireman, I mean, a lot of you probably came in, about a year, 2, 3, 4, 5. But I haven't been a firefighter since 2018. But I was from 2007 to 2018. I was 11-year career firefighter. And decided to do this full time because I started riding, started seeing a lot of crashes when I was actually taking care of people. And it's like, what can I say? What can I do? So after I left, I decided to become an MSF rider coach to learn a little bit more and understand what they're doing when it comes to education. And got to be able to teach a bunch of students and learned a lot of questions about like what problems they're having. So it allowed me to actually do more. And I decided, accident scene management instructor or something else, kind of like what we're doing here, but not much into the tourniquet, just kind of what do you do on the accident scene. It's a management for that. So that helps out a lot, and that's where a lot of my focus is. So I decided, I want to learn more about the bleeding control stuff. So tactical emergency casualty care, that's the TECC. So that is like active shooter, people are getting shot, blown up. Like what do? You do a crike, you can actually do needle decompress, a bunch of other stuff. Didn't think it was good for the average person, so I decided to take the Stop the Bleed class, and that's going to be something that is absolutely important when it comes to just kind of like what you guys are doing. Just learn to stop the bleed. So I decided to get certified. There's me back when I was 19 on the right, and I had a mustache at the time. I couldn't have a beard, spraying some kids down at the end of the year type stuff. So since 2018, I decided to do this full time, and decided to just keep making crashes and after action reviews because there's only so much you can learn just from riding and seeing those kinds of videos. And I wanted people to actually see road strategy because that was a big thing when it came to driving an ambulance, driving a fire truck, is like, how do I navigate these rough roads with a patient in the back that is critical and my paramedic, which is actually to me is more important because I don't want him to die. How do I get them to the hospital safely? So I learned a lot. I was an International Association of Professional Drivers, so a lot of certifications to actually drive these things. Learned a lot, decided to take it to a lot of these crash videos. Moto Madness, you guys remember those? A lot of Moto Madness, like Moto Stars. So back then, when I first started, huge channels, glorifying wheelies, glorifying crashing, people actually going out trying to find stuff to post it to Moto Madness. I said, might as well just take over and try to show the safety side of things. And it worked out. So that's kind of what I'm doing now. And then we got you next, I think.
So here we go. So this is about me. So from a young age, it was either SpongeBob or Untold Stories of the ER. Those were my two favorite TV shows. And so when I was 15, I started working as a transporter at the hospital. And then I knew that I wanted to do something emergency. And so then I was like, man, why don't I become a nurse? That'll at least get me in there. I can start doing work in the emergency room. And so what was really cool is where I'm from in Florida, you can actually go to high school and get your nursing degree at the same time. And so it was called Lorenzo Walker. So I went there and it was a LPN, so not your RN. So it's a practical nursing degree. I got that. And then immediately after that, I went into RN school and I graduated Florida Southwestern in 2019 and went right into the field. So I started on actually a cardiac floor, and I did that for about 8 months to a year. And I knew I wanted to go to the ER. So I got into the ER, started doing emergency stuff, working with emergency medicine and doctors and things. It was really cool. And I actually got in right before COVID started. So a lot of my emergency, at least the first 3 years or so, was during COVID. And then I was like, okay, I've done the emergency stuff. I've done a lot of the disease process. I want to start doing trauma. I want to start seeing motorcycle accidents, car accidents, things that are going to increase my skills and ability to help others more effectively. And so then I started traveling. So in 2022, I went to various hospitals around the country doing travel nursing. And then that picture you actually see is me getting ready to pick up a patient off a helicopter. That was in Montgomery, Alabama. And so there we got to do a lot of trauma. They have a lot of motor vehicle accident trauma there. And so it was really, really awesome to be able to get some experience. So let's see here. So what do I do currently? So a lot changed since I did all of that. So I had come back down from doing the travel nursing back to Florida where I live, and I was working on a unit, and outside of the hospital, I broke my leg playing hockey. And that kind of ended my whole bedside career because I couldn't walk for many months. And I started doing social media for another company. And then a year later, fast forward, I was like, man, how can I take this trauma experience, all these years that I built up, and kind of give back? Because that was what I felt like I needed to do. And then I was like, man, what if I blended this with motorcycles? And where that really came to fruition is we have this road down in Naples, Florida. It's called Three Oaks. It's kind of a dangerous road. And a lot of people like to go very fast on that road. And silly me, I decided to, thank you so much. I decided to take a ride on that road with some friends, and we went very fast. And it was a little scary. And after that ride was really the aha moment, like, holy crap, if one of us went down, I have all this knowledge and this ability to help somebody, but I have no tools to be able to do that to somebody, to help them. And so I started something called Tremoto, and that's why we're here today. And it's a trauma kit that is this small, and it fits in your saddlebag or on your hip. And so it was my idea to be able to not only spread the awareness and do things like this, and that's the main thing behind it, is I wanted to be able to spread this message and the awareness to save riders on the street. And this was kind of the way of doing so. So we're now in over 40 countries with Tremoto, and over 2,000 riders are carrying trauma kits now, which is a huge step. We've already saved 3 lives that we know of, and we have a 4th one that we're just getting information about. So that's pretty cool. But that's why I'm here, and that's what I'm doing currently. And Cliff, actually, from MSU Moto, right over there, early on when we were doing this, sent me an email and said, hey, we would love to have you guys out to do something like this. And so we connected, we talked on the phone, and afterwards, some time went by so we could wait for the next school session to start, and here we are. So he had us out, so we appreciate that. Thank you, Cliff, and the whole MSU Moto team. Let's go, yeah, round of applause, yeah, thank you. Okay, so who here has heard of Dr. John Hines? Oh, wow. Awesome, okay, yeah, that's great. Who here has heard of Isle of Man? Okay, awesome. So this video is pretty short, but I like to show everybody kind of a huge piece of inspiration, and I think everybody should know the story of Dr. John Hines because he is such an influential person, and I'll just go ahead and press play.
A 2-lane public road with stone walls, curbs, rolling hills, thousands of spectators, and speeds reaching 200 miles per hour. The Isle of Man, an island located in the Irish Sea, right between England and Ireland. It is home to the deadliest race in the world, the Isle of Man TT. Riders from all over the world rise up to this challenge, pushing their bodies and superbikes to the absolute limit. The money for winning is modest. These riders show up just for the sport and the glory of winning. The fastest lap ever was set in June of 2023 by Peter Hickman of England, who completed the Isle of Man's 37 miles in a mind-numbing 16 minutes and 36 seconds, with an average speed of 136 miles per hour. This sheer speed and minuscule margin of error means that when these guys crash, they crash big. Some of them get lucky. Many do not. Since the first race in 1907, 267 riders have died on the Isle. The last year where no one died was 1982. Due to the nature of this race, a fast first response was difficult. There was no air ambulance in Northern Ireland. Regular ambulances were slow to respond. How could you keep up with these guys and get to them as quickly as possible when they go down at ridiculous speeds? Well, what if we put a doctor on a motorcycle? Starting in 2003, at 23 years old, Dr. John Hines joined Dr. Fred McSorley as one of two men who made up the Flying Doctors. These men would follow the race on their motorcycles, nearly reaching the speeds of the other riders while weighed down by medical equipment and massive nards. They recognized the danger of this sport and were constantly learning how to make the race safer through their experiences. They saved lives by getting to any incident within seconds, and John was especially good at it.
So John, as he became, and of course at this stage he was a rising star in anaesthesia and pre-hospital care. So John really was now the flying doctor, and I was finding myself as the flying second opinion.
This team of volunteer medics is the best in the world at dealing with trauma on the trackside. Hines personally saved the lives of dozens of bikers from the brink of death. Many of them were his friends. Naturally, this team was greatly respected by the riders and the spectators alike. Hines was a teacher at heart. He held insightful panels at multiple conferences such as SMAC, and was great at bringing humor into darker but necessary subjects. He campaigned for Northern Ireland to have its own air ambulance. He was a pioneer of pre-hospital care, a subject where Northern Ireland was lacking. On nights where he was on call, his call sign, Delta 7, was the first to arrive on scene, where he worked quietly and efficiently to get these patients home.
I'd be standing in my pajamas, barely having emptied my bladder, and somehow over the radio, Delta 7 was already in the car and on his way. I used to say to him, "Do you sleep in that bloody suit?"
On July 3rd, 2015, Dr. Hines was providing medical cover for the Scaries 100 road race, where he lost control of his motorcycle and was fatally injured, passing on the next day.
His behaviour to his patients who were critically ill, if they were at all conscious, John would establish contact with them. He'd put a hand on them. He would talk to them. He would introduce himself. He would say he would not leave them. He would be with them. So easy to forget those things. He was a revelation. And when things got really hectic, and there was a lot of shouting and screaming around, John just got quieter and quieter. And he commanded attention. He always said please. He always said thank you. His crew resource management skills were exceptional. I think we could all learn a lot about that. You can command more attention sometimes by being quiet and polite. Would you mind getting me this? Thank you very much. Guys, we'll just step back a bit. We're just going to arrange that. Can you get that vacuum mattress organized? Yep, that's great. Thank you very much. That was John.
This was a man who was constantly raising standards in the medical community with an extreme passion for motorcycles and pre-hospital care. His truly selfless actions were noticed and respected. A year after his death, Northern Ireland got their air ambulance. Call sign, Delta 7.
For, as John would say, it's the honourable thing to do.
I always like to show that video to everybody because he was such an inspiration for what we're doing, especially with Tremoto. It was a big inspiration for me. And so I just think that it's super cool for everyone to be able to know what he was about and understand what he did. And he does so those SMAC talks, the SMACC, very awesome to watch. He gives some really insightful pieces of information. So anyways, so why are we here? So after today, I will know how to save a life after a motorcycle accident. That's the goal. And you don't have to be a professional to make a difference. A lot of people are a little bit worried about providing care, especially trauma care, for motorcyclists because they're not a professional. But we're here to show you that you don't have to be a professional. And what we're going to show you are things that you legally are allowed to do as well, because that's another concern. All right. And so this is just talking about that as well. Just a disclaimer that what we're going to show you is based solely on common practices and things that you're legally allowed to do. Who here has heard of the Good Samaritan law? Awesome. Okay. So everything that we show you, if you perform that action, you'll be covered by the Good Samaritan law as long as you're not doing anything negligent.
Yeah, don't get a knife and try to cut into somebody's throat. We're not teaching that. So if you do that, it's not covered.
All right. So when we were putting all this together, we were trying to figure out what's the best way that we can help you guys understand this idea of that anyone can help in a traumatic situation. And so we spent quite a bit of time
More like 30, 40 hours later.
developing this whole presentation, yeah. And so we came up with a flow chart. And so this flow chart is pretty basic. It goes over the things that we would all be able to do in the event of a traumatic incident. I guess you can read it pretty good up there.
Yeah, it looks good.
So we took that and we're like, okay, that's cool, but let's make it even more simple, because who's gonna pull out this flow chart and like follow the little lines? It's a little much. So boom, 5 steps. And that flow chart is exactly what this is here. And what's cool is 2 of the steps don't even have to do necessarily with the victim of the crash. So you really only need to remember 3 things when it comes to actually treating the person, and 2 things when it comes to approaching the situation. So the way that we can go over this is present you with scenarios. So Dan has presented some scenarios, and we're gonna look at various accidents that could occur, and then we're gonna kind of give you a result of that scenario, and we're gonna be like, okay, how can we treat this? And so we're gonna determine what to do to save a life, and sometimes it's doing nothing. And we'll show you what we mean by that. So this is gonna be scenario 1.
All right, let's watch some crashes. What is he doing wrong? What is he doing wrong? So looking back on a turn doesn't work out very well. So he's walking, that's good. Might work. Does it work better? Check. I think I got it. Thank you. Anybody do this before? Yeah? You've hit a pole? Well, you're walking, so that's good. So pretty common scenarios. Just riding in a group, not paying attention on a turn. Will you see a little road rash on his arm?
A lot of people have seen that ninja video. You seen that one before?
Yeah.
Yeah. Brand new bike. Yeah, it was the one that he had just bought. Yeah. Yep.
So very common stuff, you know, just going a little too wide in the corner, maybe not paying attention, looking back in a group ride, just crashing in the corner. But you notice that each one of them were walking, you know, after the crash. So it's pretty lucky. So for me, when I see this, because he's in the in the actual hospital setting, I'm a lot of pre-hospital as a firefighter. So when I would come up on scene and I see somebody walking, that tells me a lot. It tells me that their brain's somewhat working at least, but they're breathing, their blood pressure's good, they actually have, you know, blood's going to their brain. And if they're walking fine, like I'm walking right now, it means their legs are working. If they're limping, you kind of get an idea of where the injury's starting to happen. So there's a lot of information just by them walking around. So when we talked about those first 2, the secure the scene, maybe call 911, that's when we start getting the idea of like, oh, he's kind of fine. Maybe he's got a little bit of blood coming out. I've probably had worse riding my bicycle, you know, around town, or not around town, around my neighborhood. But yeah, you can see right there a little bit of road rash, but there's no blood spurting really anywhere. Like it's not just coming out and he's just like starting to fall over. But yeah, so this is scenario 1 where they're just walking. They call them walkie-talkies, just walking around, walking wounded. So they're still a little wounded. But it's a good idea to keep an eye on them. So they don't have many injuries, you know, just maybe some road rash, maybe a little limp. But one of the main things that we're worried about is major bleeding. Okay, so major bleeding is going to be the big one.
I actually, real quick, if you guys want to take a picture of this, it will help as we go through the scenarios. That way you can just kind of look at it. And also after, just to have it.
So on this one, if you kind of remember what when he was walking around, like the scene is secure. Well, he's not in the roadway. I'm really concerned about actually cars hitting us or anything like that. So that's a big concern. And then maybe call 911. You never know. You know, he could have a major injury, could be bleeding out, but we're not in major bleeds. Checking breathing. Remember what I said? You were walking up to him, he's talking. Well, that means he's breathing. A lot of things on calls. If a baby is crying, that's kind of a good thing. That means their airway's open. Then checking pulse. I mean, he's walking around, so his heart's working for the most part. There we go. So the scene secure, if you notice that we are not in the roadway, that's a big one. So if you do crash and you are in the roadway, it's really hard to not tunnel vision on the person on the ground. You really want to be able to look around and be like, I'm in the roadway, a car could come around and hit me, now I can't help my friend. So being able to get them off the roadway, especially if they're walking and talking, it's like leave the bike or whatever it is, let's get off to the side, and when it's clear, we'll go ahead and move the bike type stuff. And then he did a little thumbs up right there, so he's obviously checking. And that's another thing is you play, hey, you good? Especially with the Cardo Pack Talk Edge, you use the discount code, 10% in the, no, I'm just kidding. You can just talk to him, and if he says something back, hey, he has an airway. That's a good sign. If he doesn't say anything back, gives you other information.
And one thing too, so on the securing the scene, in the video, you see him, so he says, hey, are you good? And then he starts walking, and you can see him look to the left and the right, making sure there's no danger, they're out of the roadway, so just figured I'd throw that in there. So what if they're critical pulseless, they're bleeding out, you can obviously see they have direct trauma going on. Should we skip that step one and just go start taking care of them? Who thinks that we should do that? Nobody. All right,
like we're on the
good.
highway, and she's like, I'm gonna run to him.
Yep.
No, let's not do that. The way I like to look at it is that it is their emergency. Like they're the ones dealing with it. I don't want to be a part of that emergency.
So I was gonna play this video, but just for time's sake, this was another John Hines video. And what happened was he was in a race, somebody had a very bad accident, and somebody actually was getting angry at him that he wasn't going down immediately and starting to give care. And so he stressed the importance of securing the scene because you could have cars coming if it was on a street scenario, other motorcycles coming, and as soon as you get down, he says that you now lose control of the whole situation. And so that's a big deal, and you want to make sure that your whole scene is safe before you're going to start administering care. Do we call 911 even if they were okay?
So for me, I was 911, and there's been so many times where somebody will call 911 and they're like, we don't need to go to the hospital. And that's perfectly fine. You just sign a refusal waiver. I don't want transport. I always tell them, just please call 911 because at least we get on scene, we can do some bandaging, we can do some stuff. And then if they say, hey, I don't want to go, here, sign this piece of paper. I don't care about the supplies. I'll just restock and everything. If they try to take you, and there's a whole thing about informed consent and whatnot, it's actually kidnapping. So you can actually sign away. So I would always call 911 just right off the bat. So if somebody like that, when that guy crashed with that white vehicle or the white motorcycle, we don't know in 5-10 minutes he's going to just drop down because there's something bleeding inside that you can't see. And if you call 911 right away, they would be on scene and then he would drop down unconscious in front of firefighters or EMTs. Then they can take care of him. But if they show up and he's like, no, I'm good, just sign the refusal and then they'll leave. So I would, yeah, always call. I would.
And a couple of facts about it too. Trauma science shows the first 60 minutes are the most critical. And so one thing about working in the hospital is if you have somebody, let's say they were fine, they're walking it off, they're doing all right, and then they collapse, and you waited to call 911, and now they're in a what we call a traumatic arrest, they have to take you to the nearest hospital. It doesn't matter where it is or what kind of hospital it is. It could be the lowest level clinic. They will take you there because you are in a cardiac arrest. Whereas if you would have called 911 immediately and they arrest in the truck, things could be different and they'll be able to take care of you even better. And so also survivors who get early medical attention, they have better long-term outcomes. And just like Dan said, there's zero consequence for playing it safe. You can sign that form. They're usually, most firemen or EMS will say, we're just glad that nothing bad happened and see you later. All right, scenario 2, so things are gonna get a little bit more intense.
Pretty common right here, riding in town. I can't stop talking when things are going. Does it matter whose fault it is when you're on the ground? So you notice the head hit first? And that's gonna be the normal thing you're gonna say, is you're gonna say shit, 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 or whatever it is. Once you start catching, this is something I wanna say, is that once you start catching yourself saying that, just be aware that you're saying that, which means that now we're gonna get into, I'm gonna help the mode and secure the scene. Don't stay in the shit mode, because that's a panic. So get out of the panic and into taking care of your own safety at this situation.
All right. So we're gonna have some graphic stuff after this. So just letting you know. Everyone cool with that? We're good? All right. So let's say after that scenario, that video we just saw, this is what you see.
Yeah, I've seen that a few times.
So what can we see from this picture? So he's obviously sustained some serious leg trauma. They are awake and alert. So that's what's crazy about this is you can see him, he's grabbing onto the front of the truck, grabbing onto the wheel, he's awake, he's alert, but he's bleeding out. You can already see how much blood he has already lost. Now, what's crazy about a situation like this is, we'll just assume there's no other injuries, it's just the leg. This is completely treatable from a standpoint of just having a tourniquet on board. And so we're gonna kind of go through that. Yeah, you can see the femur sticking out. And so it's kind of just hanging off there.
Anybody doing like medical study or anything like that? You are? Yeah? It's pretty cool, huh? Yeah.
And so this is where we're gonna go through. So securing the scene, making sure everything's safe, calling 911 immediately. I mean, you'd see it and be like, okay, I gotta call 911. One thing that you brought out, I think, that was really cool is if you have a cardo or something like a cardo, you could just dial it in your helmet. And now you can care for them, and now you're talking to 911 on your helmet while you're treating them, which is kind of cool.
Yeah, especially if like I don't know this person, well, shoot, anybody. I wouldn't want blood splurting in my eyes. So if I have my helmet on, just put the face shield down. You got eye protection. You can talk on the phone with the cardo.
It's a good idea.
That's what I would do.
Yeah.
And then you have the helmet cam so you can film it the whole time. I knew you were thinking that.
So in this situation, this is something that you would be able to use a tourniquet for. And so we have some really awesome solutions these days, especially here in the United States. And I say that because in a lot of other countries, they don't have access to the medical equipment that we have. And so a company called North American Rescue, they make something called the CAT Gen 7. And it's a tourniquet that's this small, and it opens up. And if you want to show them like how that goes on.
First off, don't put it around your neck. Don't do that.
It's only for extremities.
Yeah, don't do that. Yeah, so, well, I mean, this is leg, so I guess I'll do my leg.
Dude.
So how are you gonna get it, honestly, like how are you gonna get it around that? You can't just slide it on, right? Well, that's the cool thing is that these things kind of come apart. So I'm gonna go ahead and break my leg real quick. Something like that. So you're coming up, you're just gonna wrap it around. Very simple. I don't wanna get the mic. And you tighten it as tight as you can. This part is very important. You don't just put it on, because then you're gonna turn this thing. You wanna get it as tight as you can. And then from here, if you notice, there's a little thing called a windlass. It's a little fun thing right here. You just twist it. It should take about 2-3 twists, and it's painful. You see how hard, like I'm doing it on purpose because you see how hard you have to push and pull, and you lock it in. Ooh, it's numb. You lock it in right here. What I like to do, and we're gonna demonstrate a little bit more. Usually on the arm, you have a lot more of this thing. Well, it's just Velcro, so it can get ripped off accidentally. Oh, gosh. Put it in there and wrap it over. And at this point, you write the time. And the cool thing is that these comes with Sharpies, little small Sharpies. Write the time. That's gonna help out the doctor, and I'm sure in the hospital setting, I probably need to take this off, but in the hospital setting, it's very important for like what, thrombolytics and all that stuff. Like,
yeah, it's especially for, so like if you had an injury like this and you put a tourniquet on, no, and that's literally how tight it's supposed to be. A lot of times, especially in the field, I mean, you know this too, that like they'll be screaming. Sometimes this will hurt more than, are you good?
Yeah, I'm good.
All right. Sometimes that'll hurt more than the injury itself because you are constricting so tight. Also, we can pass these around just so you guys can like, you know, touch them, feel them, see what they look like, undo the Velcro. Don't put it around your neck, but check it out. Here, I'll toss another one. Want to toss another one up there? Check it out. Oh, that's my bad. You can take it out. You can take it out of the plastic and just pass them around. And so these are blue. The real ones are black. They do the blue ones just so people don't get confused and use ones that have been turned a million times on a real crash victim. But yeah, that's the cat tourniquet. And back to your question. So the reason why writing the time is so important is if you're going to trauma surgery, so if you're in an incident like this and you've had a tourniquet on, the surgeon needs to know how long that leg or arm has been away from oxygen. And so with the Sharpie, that's why we put the Sharpie on the Tremoto kits, you can write it on the little time strap right there, or a lot of people will say, write it on their forehead. Write it on the arm, but usually the forehead. That way you come up and they see that. EMS are like, oh, he's got a time on his forehead. There's got to be a tourniquet somewhere. And so that's the tourniquet.
Yeah, and see how I left it? It can easily just fall apart. So let's pretend I actually did it right. I like to put it through on top, wrap it around, and this kind of locks it in. Because it's Velcro, so if somebody's walking by and their pant leg, they have to pull it pretty hard. That's just my little tidbit.
Yeah, and then I'll show them the SWAT T real quick.
All right, do that. That's pretty cool.
Yeah, let's see. My mic is kind of cooked. Let's see, can you hear me? Oh, let's go.
Maybe if we just get close to each other.
Oh.
Just talk like that.
All right, so this is the SWAT T tourniquet. So this is made by a company called Safeguard Medical. It's not like the Cat Gen 7 where it has a stick that you twist, or they call it the windlass. It's a giant elastic band. Now, obviously, there are some things that are not as good with this because you don't have something that can Velcro around. So let's say I'm trying to put it on that leg and uh-oh, I dropped the whole roll and now it's all on the ground. You know, or you go like this and then it snaps back and it's like, oh man, it's not as fail-safe as the windlass tourniquet because it has the Velcro. But what the SWAT T tourniquet stands for is stretch, wrap, and tuck. And so what you'll do is you just start it here like this, get it to touch itself, and then go as tight as you can. And this...
That's what she said.
I heard that. You said that?
Yeah, he said that.
You said that. Get it as tight as you can. And go around your leg like this, or arm. Now, the one thing about this is it's really hard to do with one hand. And so the idea with these, with tourniquets especially, is you want to be able to put it on with one hand. Let's say you're by yourself and you go down and this happens to you. You can pull the tourniquet out of the Tremoto kit or wherever you have it and put it on yourself, just like Dan showed you. He did it with one hand. And so that's one thing that this can't do, is one-handed application is very difficult. And then at the end of this, you're gonna tuck it in. So stretch, wrap, and tuck. So it's cool. If you're balling on a budget, it can work. It is approved by the TCCC for dogs and for kids. So if you're around dogs or kids a lot, or dogs or kids a lot, this one can work well for that. So figured I'd show you that one. Different tourniquet designs. And we do have the Cat Gen 7s here too. So like, let's say, you know, you don't necessarily want a kit or you just want to carry one of these Cat Gen 7 tourniquets on you. I did bring some extra that you guys can snag at the end for, they're like 35 bucks. But they are expensive, but they are legit. And a little test on those two. They tested those versus non-Cat Gen 7s, and those had a 100% success rate. And ones that were trying to copy the Cat Gen 7, so like sometimes you go on Amazon or other websites, they're trying to copy that. They had a 4% fail rate. And that's something that they experienced a lot. I talked to someone in the Ukraine who got a hold of some fake tourniquets and they actually failed in combat, and that's disastrous. So you always want to go with something that's going to work 100% of the time. So Cat Gen 7 by North American Rescue. Yeah, so this is for a junctional injury. So let's say you get the neck or you get the groin or the armpit, somewhere that you can't stick a tourniquet on, it's not going to work. So now you have what's called a junctional injury. And so you're going to have to utilize wound packing. You're going to have to take what's called quick clot if you have it. It's a impregnated dressing that has a chemical that helps start the blood clotting process, or you can just use regular gauze if you have it. So there's a little video that we have that shows you how to pack a wound.
Moving on to wound packing and how we're actually going to do it. So we've come across our wound and you can see that there's actively bleeding that's coming out of it. All right.
I like his accent.
Drawing, so we can't put a tourniquet on. So the first thing we need to do is we need to go in and we need to apply digital pressure and find where that bleed is coming from to make sure we can stop it before before we start to pack. So from here, if the wound is big enough, it's filled up, there's blood pooling around the area, we're going to open it up,
Yep.
scoop some of that blood out, and we're physically going to be looking
Yep.
to see where that bleed is coming from. So essentially looking for like a little fountain, spraying underneath the water, visibly having a look to see what we can find, and then putting our finger directly on top of that. So right now, I've got digital pressure on that artery.
You've done that.
Momentarily. Obviously, depending on the environment you're working in, it's not going to be feasible for me to sit here and keep my finger on that artery. So what I need to do is I need to start to pack that wound. So I'm keeping pressure applied to that artery. My buddy, whoever's around, the patient, I'm getting my quick clot, my hemostatic agent, or just my normal gauze to start packing. If you haven't already done so, if you've pre-packaged your gauze, just making sure you've got some tears in there, that's going to make it a lot easier to rip.
Yeah, don't use your teeth with all your blood. That'd be kind of weird.
Pulling it open, keeping the digital pressure on there, and we're going to start to pull that gauze out. Now you can rip the whole lot out and start to pack, or you can keep it in the packet and just start pulling it out.
So you notice he stopped the bleeding first, and now he's getting to it. You're not just sitting there while it's bleeding out.
Right. Now from there, what I'm going to do, I'm going to put it on the tip of my index finger, like so, and I'm going to start replacing my fingers and leaving the gauze in that location. So keeping active pressure on here. All right. I'm going to grab the tip of that finger and I'm going to slide it in and put it where my last finger was, keeping active pressure. That finger will replace it, which now has that gauze. Now from here, I'm going to start pulling that out and just follow that whole process until all that gauze is gone and that whole wound is completely packed. Keeping pressure directed in the way of where that bleed is coming from.
And it might be scary because if you have to do this or you see this as an opportunity and your buddy's still conscious, he's not going to like it. Are you going to just not do it because he doesn't like it?
So
He's going to bleed out.
so when the patient goes for an x-ray, they can actually see, so it's a radiopaque line, they can see where the gauze is actually in there.
So that's like in the areas of the neck, up in the shoulder, like right here, where you can't get the tourniquet around.
When I'm replacing my finger with the gauze, the pressure is directed in the way of where that bleed is coming from. Please don't try and push pressure anywhere else around that wound. We're going all the way back until that wound is completely filled up. So you can see here there's a lot of space to fill up. We want to make sure that whole area is nice and tight and compact. Because unfortunately, when we start to move our patient, you're putting splints on, the tissue, the muscle, that's all going to shift, which can all affect that clot, and it might cause it to blow or move, causing that patient to bleed again. So it's really important that when we're doing this packing, that we're physically and visibly looking to make sure there's no blood pooling from underneath. If we can see blood pooling from underneath, that's going to indicate that we missed that artery, and it's going to continue to bleed.
So all this training, it's one thing to watch. If you take a Stop the Bleed class, they teach you this hands-on. So it's very important.
You cannot slip into those spaces around the area. Once you've done that, we're keeping active pressure on there. Right. Now, if you're happy, or if you do have some other material around, so if you do have open it up.
Yeah.
You don't need to take the bandage out. What we can do is we can
Oh no, you don't want to stuff it there. I was going to say wrap it.
put some more pressure down there. Right. Try and keep that pressure directed to where that wound is. Okay, that's where the bleed is coming from. We want to hold it there for a minimum of 3 minutes.
And in this case, you'd probably be holding until EMS arrives. Just don't give it any chance to start bleeding again. Just constant pressure.
To wrap it up. Because again, we can't just sit here with our fingers in the wound forever. We want to be able to move our patient as well as keeping everything nice and tightly compact. Right. At that end of that 3 minutes, all right, if you're happy you can't see any pooling coming from underneath, we can just ever so gently just pull the side of that wound outwards Again, we're just making sure that we haven't missed any bleeding coming from underneath. Please, if you see active bleeding coming up from underneath, that wound is still bleeding. So we need to make sure that we go back and rectify that problem.
And in that case, if you're on the street, oh, yes.
How different is it if there's multiple arteries that are like cut?
So if there's like multiple arteries cut, I mean, obviously it's gonna be bleeding a lot more. And that would be a situation where if this is too slow, you're trying to pack it, it's still bleeding everywhere, or you're doing that one, but you're bleeding from under here and they're losing a lot of blood, then it's tourniquet time.
Yeah.
That'd be time to whip out the tourniquet. So usually, oh, sorry, the thumbnails are a little crazy. Usually, you're gonna wanna start with the,
Yeah, look at that.
oh yeah, we'll do that one soon. You're gonna wanna start with the wound packing. So if you have a laceration, like what looked like in that little training dummy he was using, you would start by packing the wound first. You don't always wanna go just straight to the tourniquet because they're bleeding. You wanna try packing first. If you're packing and kind of like you were saying, and it's still bleeding, or there's another big wound and it's just you, and like he said, oh yes?
Why is that preferable
To do the packing first?
instead of a tourniquet?
Just because you can actually, you want to try and minimize the loss of the limb, or I should say the loss of oxygenation to the limb. So if there's a situation where you can pack the wound first and that's enough to stop the bleeding, you could prevent the rest of the tissue damage.
Because there's other
Yes.
places getting blood.
Yeah, exactly, yes. So, oh yeah, go ahead.
So when you start with the packing the wound, a lot of it is because that's in that junctional area. So like right here, or like in the shoulder, maybe like up in here, you're packing the wound. So you can't get a tourniquet there. And so to your question, it's like, ones if there's like multiple, you're gonna have to do your best. It's kind of that's the best thing you do. You start with one, you go to the next, you go to the next, you go to the next, and hopefully you're quick enough. Hopefully it's not bad, but once again, that's kind of the situation you're in, and you're doing your absolute best. That's all you can. You can't solve the problem every single time. When it comes to like, why do you want to go to tourniquets versus, doing packing the wound? Tourniquets definitely on the legs. That's simple, quick. So if he's bleeding out right here, just get a tourniquet, but he's also bleeding right here. Get the tourniquet, stop that, and start putting some time into this one. And remember, we're doing motorcycle accidents. So with motorcycle accidents, yeah, they're gonna be tumbling. Hopefully they're not gonna get lacerated all over the body. Maybe you're gonna have one major, hopefully, and then a lot of road rash, so you're having different levels. This also applies to GSW, so gunshot wounds. You're gonna possibly have some more of those, maybe some stabbing type stuff. This is also applicable to that, but now you're having multiple deep penetrating possible artery stuff. Go ahead. I would just keep packing more. I'd find more stuff.
Eventually it'll become such a hard ball in there of gauze that it'll eventually hit that artery.
Yeah, it's like baking your cake the first time. It just looks like crap, but it's gonna work. You just keep going. That's why I always carry like 2 or 3 of things that I have, in case something doesn't work or they have multiple.
So like in every Tremoto kit, we have 3 gauze rolls. So you get over 12 yards of gauze to pack with, which can also double as wrapping material if you need to wrap a wound. That's a great question. So in trauma, usually we don't care much about sterility. Usually it's always treat the bleeding first. We can always treat an infection in the hospital. So in this situation, if there's dirt involved or anything around, like don't worry about things being a little dirty. You're here this is life or death. We're here to save their life. If they're bleeding out profusely, you do whatever you can do to stop that bleeding, even if there's a chance of infection. Yes, you could use your t-shirt, you could use anything. Pack that wound, get the bleeding to stop.
Don't pack it with dirt.
Well, yeah, yes. Don't pack it with dirt, but
don't.
enough space to, oh, so that's why we have trauma shears in all the Tremoto kits too. So oh yeah. Oh, you say cut the arm off?
No, the arm.
Oh. So yes, X shears, it's actually from Michigan. They're from here. They make an amazing product. A lot of EMS personnel use this. And so that's where you would expose that area. Sometimes you'll notice too, there's bleeding coming out of the boot or their boot is pooling with blood. That's a situation where you'll want to expose that area and see really what's going on. and that'll cut through it.
Long time.
Sorry, what?
How long can a limb be in a tourniquet?
How long can you what? Oh, be in a tourniquet? Oh, okay, this is a great question. So the common misconception is that as soon as a tourniquet goes on, you're kissing that limb goodbye. That's what a lot of people are taught, or that's kind of what people hear. So that's not necessarily true. You obviously want to wait until the last possible second to use a tourniquet. Make sure that you can't pack it first or stop the bleeding by any other means. But just because you use a tourniquet doesn't mean that that limb is gone. There's been instances where you can go 4 to 6 hours and they've still been able to save that limb. So it kind of just depends on the situation, but yeah, it doesn't mean they're gonna lose their arm. Yep, yeah, go ahead. Potentially, yes. So there is a potential for causing damage with a tourniquet, and that's why you always want to let it be your last ditch effort. If you can't stop the bleeding, you don't want to see somebody with a little bleed and be like, oh my gosh, I got to put a tourniquet on, and now you're risking damaging, the arm or the limb. So yeah, but there is always a chance, and so that's why they always say leave it to the very end if you have to.
Well, I wouldn't take the tourniquet off once it's on for me.
Yeah, once it's on, it's kind of
pre-hospital,
like,
so.
yeah, they usually want you to leave it on. And the reason for that is because you can actually create a thrombus, or you can create a blood clot behind it. And then if you release the tourniquet, now that clot could circulate, and now you throw a pulmonary embolism or a stroke. So yeah, once you commit, that's it, leave it on.
So like on some of the last few questions, like, well, is it going to cause damage to the arm if I put a tourniquet, nerve damage, or how can we save it? To me, if I see my buddy bleeding out of his arm, I'm not thinking, how can I save his arm? I'm thinking how I can save my friend. So if he's bleeding out, I'm gonna put a tourniquet on, and I'm gonna hope he can keep the arm, because the goal is to get him to the hospital, but I wanna save his life. So I'm just gonna put a tourniquet on, and I'm gonna do it quick. And they have medications and everything, so once they get to the hospital, hopefully, take care of all that stuff. And when it comes to the infection, it's like, okay, well, I'm gonna put my shirt inside if I need to pack the wound. They're still going to treat them with antibiotics when they get to the hospital anyways.
Yeah. That was one of the first things. So as soon as a trauma victim would come in, one of the first things they get was start pumping them with antibiotics, because there's going to be some sort of path of infection that starts, when you have trauma like that. You're opening your body up to the elements in the road and things.
So when you're packing a wound, if there's like a foreign object in it that caused the laceration, are you supposed to remove, if it's like a piece of bearing or road debris or that caused that laceration, should you remove it or just pack it in place as is?
So that's a pretty good complex question.
For me, if I ever got into that situation, remember when he stuck his finger in there to stop the artery? If you feel something in there, you might want to, if you can, but if it's not moving out, just leave it and start packing the wound. They're going to do that in surgery. If it's something sharp and you're cutting your fingers doing that, if it's my friend, if I liked him, I'd keep packing the wound.
That does bring up another thing, though. If it's a penetrating injury, if it's something where they got stabbed, like a lot of us have seen that video of the stick that goes in the guy's foot while he's riding. So if it's something like that, never try and take it out, because that can actually be the reason that they're not bleeding. So if someone gets a stick through the abdomen or something, let's say, leave that there, because that is a trauma surgery thing. They're going to have to remove that under surgical conditions and make sure that it's not bleeding. So a perfect example of this, this is an extreme one, but it's a perfect example. There was a young girl and a brother, and they were playing with pencils, and they were sharp pencils. And the brother was joking around and swung the pencil around, and it got her right in the neck. Now, the pencil, they decided not to take it out, and they went to the trauma bay. When they did the surgery, they opened up her neck, and you saw the picture. The pencil went cleanly through her carotid artery and was actually sealing up her carotid. And so if she would have pulled that, she would have bled out. And so definitely something, if you have a penetrating injury and it's not bleeding, even if it is bleeding around it a little bit, leave it there.
Yeah, it's packing the wound already. So it's good.
Yeah, all good? Okay, any more questions? All right, keep on going. Oh, that one real quick.
Oh yeah. What would you do there?
Yeah, what would you guys do there?
Touch it?
See, I heard a couple tourniquets. Tourniquets? Are they bleeding?
Yeah, do you see any blood pooling or anything like that? It's bleeding out?
This is something where I was like, where we said earlier, sometimes you don't have to do anything. This is the perfect situation. Sit tight with them, wait for EMS to arrive. They're not bleeding. It looks terrible, but there's nothing that we necessarily have to do. So going on that checklist, securing the scene, calling 911, there's no major bleeding. It looks terrible. They're breathing fine. They're alive. We just chill and wait with them.
And for me, if I saw that and it is my friend, I see the leg there and there's no bleeding, I would just preemptively get the tourniquet and not tighten it and just put it up there on the leg. Because then if all of a sudden we move and maybe a sharp bone slice something and starts bleeding out, I can just cinch it tight. I'll just buy a new tourniquet. It's worth it to me.
All right, scenario 3.
Who likes to speed before they get on the highway? This could happen. And no gear. Hey, group ride. More like a mob ride. So we got 2 patients, really. Just one looks really bad. Yeah. So even just riding by and he's not getting up, self-preservation, not getting up, that gives you a lot of information. We don't know if he's breathing. We don't know if he has blood loss or it looks like he's unconscious, or he could be faking it. We've seen some of those. And that gives you a lot of information. Now, it could take you away from the other guy that crashed. Maybe he had a laceration in his leg and he's bleeding out and everyone's focused on the guy that's unconscious. That's why I said there's 2 patients. Double check, make sure everyone's fine. And then if you see some bleeding, you can stop the bleeding, now get to the other guy.
Yep. And that's like something that flow chart also does well at is when you're going 1 and 2, you've already called EMS, and you get to 3, and one of those people has major bleeding, but the other one doesn't, start with the major bleeding one and stop that. And then you're gonna move on to the next one.
And part of like what we're doing here is that if, let's say we're all going on a group ride tomorrow for some reason, and only one of us knows how to handle this incident, but then there's like 5 people that crashed. Well, that one person's gonna have to triage, and they're gonna have to pick the most savable person. Now, if all of us understand how to do stuff, and 5 of us crashes, we got like 5 people per person to help out. So that's very important to have as many people understanding what we're doing here.
All right. So before we get into the actual how we would treat the scenario, why do we not remove helmets? Does anyone know? Good. Yep. And right here. Yes, that's a big one. That cover it? Anyone else? Yep. Exactly.
So another reason why we don't remove a helmet is if it's a half helmet, if it's a 3/4 helmet, because you can still access everything, right? But why would we? Yeah.
All right. So this one's actually really interesting. This picture was actually someone I took care of at that hospital that I was working at in Alabama. And you can tell this is almost a full internal decapitation incident. And so this is why we don't all of a sudden go right to removing the helmet, because this is what their neck could look like inside. And this person was paralyzed. And so what can happen is if you have a total severance, or let's say a partial severance, and you go to help and you jiggle their head or you try and get the helmet off, you could cause a complete severance and now they're fully paralyzed. And once that happens, there's no fixing that. So very important with that. You can also cause loss of airway control. So let's say they're breathing, and it's like, okay, they're doing okay, and you're like, okay, let me just get the helmet off, and now you've created a shift where they were barely able to keep their airway open, and now they can't. So now you've created a new emergency. Same with the spinal cord severance we were talking about. They can start to become agitated and start moving around because you created pain, whatever it may be, and increase intracranial pressure. So ICP, that's a medical term that we use where if you're bleeding in your brain, already, and you try and pull it off, and now they're like, oh, the pain, you're increasing that pressure, and you can cause more damage in the brain. So
that was a big fear whenever we moved a patient. That's why I don't want to most of the time. So yeah, only necessary is when it interferes with the airway or breathing. So that's why I said if it's a half helmet, you still have access to the airway. If it's a 3/4 helmet where it just covers the crane, like the skull, you have access to the airway. If it's a full face and they're not breathing, you don't have access to the airway. If it's a modular helmet, you can just pop it up. So that's the only time you'll ever remove a helmet is if they're not breathing, if they're vomiting, so now they're gonna aspirate, so now they're not gonna breathe. And if they're in actual cardiac arrest, so you're gonna have to do CPR, maybe rescue breaths. But if you're still like, I don't know if I should do it, well, just don't do it. Do your best, but if you feel uncomfortable with any of the stuff that we're talking about, you don't have to do it. Yeah, I would. There's been a lot of times where I'd get on call, and maybe not after an MVA or anything like that. It's just a regular patient. It's like, hey, let's go ahead and stand you up and see if you can like take care of yourself. Because they'll be sitting down. We show up. They're like, I don't want to go. Okay, cool. Can you stand up for us and just stand there for a little bit with the BP cuff, and we'll take another one. So it's like orthostatic type stuff. And sometimes they'll just, okay, and they start falling over and then fall down. We don't want them to have another head injury.
Yeah, and a lot of times, a lot of times people right after an accident, you see they get up, just like you were saying, they get up, they're all excited, adrenaline, and then they fall back over. So one thing to do too as a caretaker is you run up to them, you say, hey, just relax, let's sit down for a second, or lay down. They try and get up, that's the thing too. They may have a spinal injury and they're trying to sit up on you. Just tell them to lay down, let's wait for ambulance to get here. Go ahead.
So if step one to the whole process is securing a scene and they go down the road or what have you, and they're in the middle of the freeway or something, you're not supposed to move them, but how do you secure the scene in that situation?
Exactly. So that would be securing the scene, is getting them out of harm's way. So in
a situation like that, you should.
Yes.
So I always, whenever it came to like a fire call or an EMS call, it's like, if I don't do anything, will they die? If I do something, could they survive? I tend to just do something. Yeah. But if highway, is it safe for me to go out there? So sometimes it's not.
Yeah. Is it possible in a particular type of accident that the helmet gets stuck on the body? So is there a way to deal with that properly?
I mean, yeah.
Yeah.
Especially if there's intracranial or extracranial swelling, it's getting the helmet stuck. It's kind of like do your best kind of thing,
Yeah, I just, a lot of the what ifs. A lot of the what ifs come down to like, here's the worst case scenario. I've been on a lot of calls that maybe saved one person. It's kind of what it is. Well, CPR wise. And in that situation, if they're not breathing and they don't have a pulse, the main thing is keeping their brain alive. So then you could do chest compressions for CPR type stuff and just kind of leave the helmet. If you're really struggling to pull it off and you're like, I need to get it off because they're not breathing, maybe you shouldn't pull it off because we're worried about the neck now. We'll go back to you there.
I've had a motorcycle accident, and when it happened, I sat there and I thought I was okay, stood up, and took my helmet off myself.
Yeah.
Come to find out, I broke my collarbone and I started passing out. So, and EMS had to, they neck brace me and everything. So.
Yeah. You don't even know until you have, you know. Yeah.
So if someone's bleeding out and they can't breathe, would the bleeding be the first priority, or would clearing the airway be?
For me, on like a pre-hospital, if I showed up and somebody's bleeding out and they're not breathing, I'm more concerned about the bleeding because they still have oxygenated blood. So I want to make sure I close it up, and then I'm going to get to the breathing. So, I mean, their brain is still, if their heart's moving, the brain's still getting some of that oxygenated blood, but if it's bleeding out, then there's nothing in the pipes. You ever worked with a pump or anything like that? There's no water. It's not going to work. The pump will finally shut down. So I'm worried about the bleeding first, and then I'm going to get to the breathing.
Within 2-3 minutes, you can lose your entire blood supply. So if you even spend 30 seconds to go try and take the helmet off or clear the airway, they could lose half of their blood supply. And then you fix the airway, but now they have no more blood to oxygenate. So that's why we created that flow chart that bleeding is number one. Same with like CPR. Let's say you go, and we're going to cover that. Their heart's not beating, and so they're like, okay, I need to do CPR. You're pumping their chest, but you're pumping all the blood out. So taking care of that massive bleeding is always number one. And one phrase I wanted to say, so all these questions have kind of centered around, should I do this before that? Life over limb. So if my friend's in the roadway and they're bleeding out, whatever, secure the scene first. Life over limb, I'm gonna take them even if it does risk maybe their spine, but they could get run over by a car. I gotta save them first, get them out. Same with the infection. I need to stop this bleeding, pack this wound, might be a little bit of an infection. We can take care of that later. Life over limb. And then, oh, you're good? Okay, all right, make sense? Awesome. And so back to that scenario that we just saw. So let's say that one guy that was down with the mini bikes, he's on the ground, he appears to be having trouble breathing, and you go in there and you open his visor and there's tons of vomit in there. That would definitely be grounds for removing the helmet because he can't effectively breathe. And let's say you've gone through all the other steps. There's no bleeding, no nothing. Like you saw, he was there, but we'll just say he wasn't breathing. You good? Okay, cool. So oh yeah, go ahead. Yes, that's a great point. So a lot of helmet manufacturers are now adopting those quick straps or like the pads that are easily removed. That way, getting the helmet off, if it is hard to remove, comes off a little bit easier. So, all right, cool. Helmet removal demonstration. I guess.
Show it.
Yeah.
Okay,
quick. Yeah, real quick. It's kind of hard to do it on the ground, so I'll put it on.
You want to just do it?
Do you want me to do it on the ground?
Yeah, just lay down. I'm going to show them how hard it is. Because that's really the thing is like.
You want me to lock this up too? Or?
Yeah, lock it up. Go and lay down. Put your head towards me. Lay on your back. So it's very difficult to actually take a helmet off in an emergency situation, trying not to mess with their spine. So remember, the only reason why we do this is if they're not breathing. Okay, that's really it. And that's if I want to have access to his airway. So if I know how to do CPR mouth to mouth, I'm going to want to do that. At the end of the day, you could just do chest compressions over and over again. So when it comes to the helmet, the whole point of this is to show you how difficult it is. So you're unconscious. Go ahead and lay all the way down. There, you're all the way down. Oh, he's got a nice little spoiler thing. That's nice. Yeah. So he's unconscious. He's not breathing. I already did the full check because I'm worried about his bleeding and everything. It's just like putting your helmet on itself. You have to go through the straps and you do this when you put it on, like take it off and put it on. It's the same process now that he's not using his arms. I'm using my arms. So I'm gonna have to come into here, take it all off. And it's just like you were doing with your own helmet. You're gonna pull it to the sides and you're gonna slowly, you see how it's starting to, like his neck? He's unconscious because he's not breathing, remember? And usually about this point, now I'm gonna show you real quick, you're unconscious, so if I let go, see how his neck just starts rolling? So we'll get back up. I'm just gonna put it halfway. You got it? Yeah. All right, so when I get to this point and I'm pulling it, it's kind of getting past the main part. So now I'm gonna go ahead and grab in and get my hand underneath his head. And then from here, I have nothing, so if I have a backpack, I'm gonna slide underneath and pat it. I'm gonna get my shoe off if I have to. I'm gonna put it underneath and pat it, because if I just let go, now we have that issue. The helmet itself is actually keeping his head and neck in line. But if I need access to his airway, if he's vomiting and everything, I need to clear it out. So there's other stuff that you're gonna learn, like log rolling, moving the patient, and all that stuff, but at this point, a lot of people ask, how do I take a helmet off? But you see how hard it is? You have to be very careful.
And one cool technique that actually Dr. John Hines has in one of his videos is if you encounter somebody with a one-piece suit and you need to get them out of the roadway, let's say, or move them somewhere, unzip it down the middle, and if you have another person with you, grab each side of the suit now that it's unzipped, and you almost have like a tarp or a backboard, so you can just carry them like this and their spine stays in line with the one-piece suit, which is pretty cool. So, any questions on helmet stuff? Cool. And this is just kind of reinforcing this point of, if you're in doubt of anything that you're doing, you're like, ah, man, I don't remember this, or I don't really know if I know what to do, then just don't do it, because you don't want to risk hurting somebody further. So we just want to encourage that too. Don't do it because you want to try and be the hero, or like, oh, I can save them. If you're not comfortable, don't do it.
And I'd like, before you move to that, so when in doubt, do not act. Act only in your training or comfort level. That's the same thing for motorcycle riding. That's the absolute same thing. Oh, this corner, I want to go up this mountain. I'm not comfortable. It means it's not your training level. It's not your skill set. So just don't do it. And so when it comes to somebody injured and possibly helping them out, if you're not comfortable, it's okay. You're gonna feel guilty. I already know that. You're gonna feel guilty that you couldn't help or you couldn't do this thing. That should bring you to the next step of, I need to get more training. It's like, this is a good wake-up call to get more training. I don't know. I like that slide.
Yeah, that was good.
Yeah. Yeah.
Who's got the JBL?
Oh, this is a good one. Oh, yeah. Well, he's standing up, so that's fine.
Well, no, that was the other guy.
Was it?
Yeah. So when I was doing this, when we were putting this together, I was like, did that guy that got hit just stand up? It was actually the guy in front of him. The guy that actually got wrecked stayed on the ground.
Okay, so I mean, what are you gonna do with that?
Here, I can go back.
Yeah, go back a little bit. I want to see that again. So this one, high speed. There's leg, hips.
Yeah, so watch the guy that actually goes down.
Okay.
It's the guy in front of him that goes back. He's the guy that stands up.
So the guy that ran him over.
Yes, there, he stands right up.
So like, that's a great thing. So left leg, as soon as we hit, left leg injury, flipping over, maybe perfectly fine. Crushing injuries, okay. And then the other person running him over, what do we have on the sides of our bikes? We've got pegs. And so if he lands sharp peg in a junctional spot and he starts bleeding out, that's when you start seeing some of that stuff. You have to pack the wound. But then you also might have a deep laceration or an amputation. So now you have to do a tourniquet. Like, what do you go to first? You just do your best, go to anyone first. I would do the tourniquet because it's basically another set of hands. So somebody who normally would have to like hold pressure. If I use one of these and I put it on, it's holding pressure on that leg. Now I can use my hands for the packing of the wound.
And that's where like we also have these too. So another thing that's included with the pro kits, or if you want to get it separately, it's called an emergency trauma dressing. So it's a compression bandage. And so this really helps if we are in that situation where you have multiple wounds that are bleeding and you need to start with one and then keep going to the next one. It's got this pad on there and you throw it on like this and you just start wrapping it around and around. And so not to be used as a tourniquet, but something that just creates a lot of pressure on top of that wound you just packed. So now you can free up your hands if there's other things that you need to do, obviously if the bleeding is stopping through these means. And then if not, then you would go.
So like a lot of accidents like that one where he did hit the side of the vehicle, let's say nobody else hit him. What I typically would see is an avulsion. Anybody know what an avulsion is? It's basically a big flap of flesh kind of peeling out.
Can I just look up a picture of an avulsion?
Do you want it? Yeah. Find a good one. Degloving is good. Yeah. Traumatic open book fracture. Go and do that one. But yeah, an avulsion. So like that one, yeah, it's bleeding. It's like oozing blood. So there's different kinds: capillary bleeding, venous bleeding, arterial bleeding. So if it's just like open and it's like bleeding pretty bad, maybe I don't need a tourniquet on it. I mean, it's just kind of coming out a little bit. If I just close that flap back and I start putting some pressure on it, then that saves me a tourniquet for maybe the other leg or other arm or whatever it is. So that's where certain tools for certain situations do come in handy, but how are you gonna know which tool to use? That's where going to take an actual like stop the bleed class, if you wanna go crazy, TECC. It's the civilian version of like TCCC where it's, oh, there you go. That's a degloving injury. And sometimes they don't bleed very much. Yeah, they don't bleed.
It's just like you're just skinning. Literally, like think of it as a glove, degloving.
It's like the
skin.
Like baked chicken skin.
Yeah. I mean, usually this happens when like something either pierces through the glove. I mean, obviously the best protection is going to be like your GP gauntlet gloves, right? I mean, not everyone likes to ride with those kind of gloves, but something with that, they have the protection here as well. So if you go down, you're there, and then the knuckles as well. But sometimes you get something that's so sharp that you actually pierce through that and it will still create that degloving. Not necessarily.
I wouldn't know on that. I think of degloving injuries as kind of like blisters, not bad blisters. So a blister is just the skin on the skin. You have that little, but it's because it's something pushes and it's like pushing the skin across the top. Now you have a blister. When it comes to a degloving injury, it's a very hard impact pushing against, and then that's when it's starting to rip flesh too off the bone. So there's what gear would protect a major impact against the car 50 miles an hour? Not much outside of, I mean, you would still get degloving injuries in a car accident.
So, and we're oh yeah, go ahead. Like if your hands are on the steering wheel and you got an accident and, oh, the airbag?
Yeah, that could do that. Most of the accidents I had with airbags, they'd have their hands there. So they would get like a wrist fracture, but then burn marks from the propulsion from the airbag. I haven't had a degloving. It sounds like it could happen because those airbags go like 200-300 miles an hour instantly.
And a lot of times for like on the feet, you see degloving on the feet or avulsion on the feet a lot. And a lot of times it's for not wearing proper shoes. Like a lot of people are like, oh, I'll wear like, you know, some basketball shoes, some Jordans, and they come up over my ankle, I'll be good. You know, they actually come off way more frequently than you'd think. So go ahead. Yep.
All right. So you showed a quick picture of the foot after the degloving. We see like what tooling should we take it off to treat the?
Take off
The boot, like if it's pulling inside there.
Well, I mean, it's either going to be like degloved or not. Like you'll see it. It's like either going to be there or not. If it's not bleeding, this is one of those things where like if it's not bleeding profusely, either try and just kind of pack on top of it, I would say, right? Or
So like that scenario where somebody has blood coming out of their foot, I don't know if it's degloving yet, like, because I haven't seen it. So my idea is that I'm going to take the boot off, and now it's like, oh, it's degloved. Now what do I do if it's continuously bleeding? That's where either a tourniquet or one of these things would come in handy, but you're never gonna know until you take it off. Now, if you're trying to take it off and he's like, oh, stop. All right, I'll stop, but you're bleeding. So if I need to, I'm gonna put a tourniquet up the leg to stop that bleeding.
Or that's where the trauma shears will come in handy. So
Yeah.
instead of having to pull it off, you can just start cutting the boot. And so you might have seen, I actually made a video cutting through a boot with these exact shears. So that's pretty cool. I think you had your hand raised, right? Yeah.
I was going to say, like, if it's a foot injury, does the tourniquet still go all the way up?
Oh, that's a good quote. We actually did not cover that. So current standards, regardless of what anyone tells you, 2 to 3 inches above the wound site is current TCCC standard. If for some reason you're not able to stop the bleeding with the 2 or 3 inches above, then you go what's called high and tight, where you just put it as high as you can, because you know that will stop the bleeding. The people who tell you that's not correct, high and tight is the only way, it's because, and sometimes they'll even say TCCC says high and tight, and it's because that's in a combat situation. So when you actually read their article that they publish in their books every year, that is when you're under combat or in fire. You're gonna just put it high and tight because you don't have time to check and see if the bleeding stopped. Just put that thing on and we keep firing. But when we're on the street, we have time to assess it, 2 or 3 inches above. There was a big video that dropped of the guy who was stunting, and someone had a tourniquet, and the guy was like, put it on the wound, put it on the, and they were like putting it almost right on top of it. It was like, whoa, you saw that one?
I didn't see that one, but that sounds
Yeah,
like
so 2 to 3 inches. That's the advice.
Yeah.
All right, good. Everyone good? Okay. Yeah, degloving is a solid
Yeah,
one.
it's a gross one.
Dude, did you put that on there?
No,
the
they
JBL?
Did. They did. They absolutely
Because
did.
like the beat hits right when he falls, and I was like,
I like it.
yeah.
Good editing.
Okay. All right, so scenario 4. So from that, let's just say that there's large bleeding coming from the arm. They're unconscious, not breathing, and pulseless. So if we go through that flow sheet, what's the first thing that we do? Secure the area. Boom. All right, so We're going to secure that area. And so this area is secure. There's people standing around. They're obviously in a place where the area is secure. What's number 2? Perfect. Okay. Number 3. Okay. So any major bleeding here in this picture, can't really tell too much, but we're going to say that there's a large bleeding coming from the arm. So we're going to take care of that first, whether it be a tourniquet or packing the wound. And now they're unconscious and not breathing. So number 4 is check their breathing. So respond to the breathing. So now we're going to figure out what we need to do with that, whether they're not breathing because there's a blockage, their airway is not intact, or they may not be breathing because they're actually dead. They've had cardiac arrest. And so if someone's not breathing and you don't see anything obvious, like, okay, their airway looks okay, I don't see any trauma, I don't see any vomit or any blood or anything, check that pulse immediately. What's going on here? They might be pulseless, and that's why they're not breathing. And so this here is actually, this is very sad. This happened next to my house just a few days ago. And so I blurred the faces and removed any kind of identifiers. But this person unfortunately passed away. But I show you guys this because this is how it happens. And it's something that we definitely need to educate and bring awareness on. And so yeah, it happened close to home, so it was kind of unfortunate. So if you need to do CPR on somebody, we're going to show you a quick little video on how to do breathless CPR. Getting your CPR certification or an official training, we definitely recommend. And that's true with everything too, like an official Stop the Bleed course so that you can be certified on these items. So just like that, certify yourself with CPR, take a CPR class. Sometimes they're even free, and they'll certify you so that you know exactly what to do in case you encounter a CPR situation.
A cardiac emergency can happen anywhere. Be prepared with a simple technique known as compression-only CPR. You can learn it in minutes, it's easy to remember, and it can help save the life. If someone suddenly collapses, check the scene for safety. Then, check to see if the person responds to you using the shout, tap, shout technique. At the same time, check for breathing, life-threatening bleeding, or another life-threatening condition. Are you okay? Are you okay? If at any time you determine the person is experiencing a life-threatening emergency, call 911 and get the first aid kit and AED or tell someone to do so. Anna, call 911 and get the first aid kit and AED. Then, if they are unresponsive and not breathing or only gasping, begin compression-only CPR. First, ensure that the person is on their back on a firm, flat surface, such as the ground. If they are lying on a bed or couch, carefully move them to the floor. Next, kneel beside them like this with your knees near the person's body and spread about shoulder width apart. Place the heel of one hand in the center of their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of at least 2 inches at a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. Finally, keep going. Continue giving compressions until you notice an obvious sign of life, like breathing. An AED is ready. A trained responder is available to take over compressions. EMS personnel arrive and begin their care of the person. You are alone and too tired to continue, or the scene becomes unsafe. If you would like to learn how to give full CPR and use an AED, you can take an American Red Cross CPR AED course. Check out redcross.org for more information.
So Red Cross is one of them that does the CPR certifications. And one thing you saw too, 2 inches. So you're really pumping on this chest. I've seen a lot of videos of people trying to give CPR and they're just kind of, they're not, you got to put your body into it. A lot of times people are afraid in the beginning because sometimes you will crack ribs, you'll break the sternum. That's normal. Yep. And so one thing I wanted to say too about that one picture, the one that was close to home, I know the outcome was sad, but there was a video that picture came from, and I wanted to show that video. It was a bystander video, but I wasn't able to blur the faces out and keep everyone's identity protected, so I just did the picture. But in that video, you see two people giving compressions, and it's very effective what they're doing. There was the one girl here and the guy there, and halfway through the video, you say, okay, you see her say, okay, your turn, and he hops on and continues. And so it was very effective CPR. And so if you have somebody with you, don't be afraid to break it up. Even if it's one rotation of 30 or 40 or 50, give yourselves breaks, switch off, because it's very easy. People underestimate how easy it is to get tired from doing chest compressions. It's very vigorous. So
yeah, for the quick recap to kind of get over this part right here is that the main thing with the secure the scene is that if it's not safe for you to go, don't go. Like when it says secure the scene, it makes it feel like, hey, I'm going to make sure everything's fine. If it's unsafe for you to get in there, then don't go in there. If you feel like with enough training, it's like, I'm not as nervous, I can do this and I can get in there and help my buddy, then go ahead and make that effort. But one of the big ones is definitely call 911, because there's been a lot of times, especially when I've shown up on a scene as a civilian, and I show up and I'm like, has anybody called 911? There's already like 8 people standing around and nobody's called 911. And so that's why you always tell someone to call 911 or you call 911 yourself, because that starts the process of possibly getting them to surgery. That's what they're going to need to have. And then stop major bleeds and assist breathing, and then check the pulse and CPR.
If there's like multiple lacerations and there's like multiple people that are available, can one person like pack a wound that needs to be packed, another one applies a tourniquet if it's required?
Yeah, especially if, like going back to his point, if only one person knows what to do and they're able to manage the scene, that's always something available to you. Is like you get down with the person and someone comes up and they're like, I don't know what to do, like, can I help? You can tell them, hey, take this, pack that wound up, or hey, put this tourniquet on. I can show you how to do it, but I'm doing this right now. As long as you, the provider, are following the flow sheet and you know what you're doing, you can kind of start to delegate and say, hey, you call 911, please. And I'm gonna go ahead and start doing this. Someone comes up, hey, help me pack this. All right, I need you to hold pressure. Let's say you don't have time to throw on this bandage over the gauze you just packed. Hey, come here, give me your hands. I need you to put pressure right here. And then now you move on to the next thing. So even if there is only one person or there's multiple lacerations, things going on, now that you know what to do, you can tell people and delegate things off and have them help you. So, yeah.
Just two things. The secure the scene piece, I don't think you can emphasize that enough. Having a friend that got in a motorcycle accident, survived the accident, really wasn't hurt that badly, and then got hit by a car after and was killed. So, and they had stopped the traffic. So just the secure the scene is just really, really important. And the calling 911, you don't hang up on 911, stay on the line. And to your point, don't assume when you say call 911, there's 30 people here. No one, you've got to point to someone.
Mm-hmm.
You call 911 and stay on the line. Don't hang up on them. So do that.
That's a great point. And even if you got to just throw it on speaker, or you have it in your helmet, throw it on speakerphone while you're working on them. You can tell them, hey, I'm working on them right now. I'm trying to stop the bleeding. And then to, like you were saying, pointing at somebody, people like to feel important in a situation. So if you point to someone and say, hey, you're in charge of calling 911, they're going to do it. So super important. Yeah. Let's see what else we got. You guys feel more confident in saving a life after a motorcycle accident? Yeah. All right.
It's a lot of information. And
It is
you
a
need
lot.
more. You need to go take a stop the bleed class, CPR class. There's a lot more you need to know when it comes to this stuff. But at least now, I'm hoping if something happens, you know to call 911 at least and maybe stop some bleeding. Yeah. Good.
Oh, and that picture was kind of cool. That was in Denver, Colorado. So that was kind of like what we're going to do tomorrow. We're doing a whole ride out. That was a couple of the guys from the ride out on that trip. It was really fun. In the mountains, we actually had someone go down too and almost go over a cliff, but they didn't. So, yeah, but it was cool. Yeah. And so then that's why we say carry the tools to save a life, because now you have the knowledge, but if you don't have the tools, you can't sit there and think like, oh, okay, yeah, I'm gonna stop this bleeding. You gotta have the tools to do it. And so that's why I created the Tremoto Trauma Kit, because I wanted everyone to be able to have those tools. And so I've already built it into a kit that can cover every single thing that we covered today. And so I have some here. If you wanna snag some, I do have some of the tourniquets extra, or if you wanna throw one of those tourniquets into the kit extra, I have that too. If for some reason these all get bought up, I activated a code, MSU25. If you wanna go on Tremoto.com, that'll give you free shipping. So if I run out of these and you really want one, you can get one. And same with, were you?
Yeah, I mean, I got this. I just don't want you guys to crash. So I got the drill booklet. So I mean, if you guys,
dude, you downplay it, man. These are awesome.
I know.
Hey, come on, these are sweet.
These are fun.
What he did is he.
All right.
No, we got to go through it, man. He downplays it way too much. This is really awesome. So if you're new at riding, or you want to just increase your skills, tight turns, things in a parking lot, that's all you need is a parking lot. He has all these drills that he's set up, and you have videos for each of them, right?
Yeah, here we go. I'll do my spiel. All
yeah,
right,
do your spiel. Come on.
So it's Smart Rider motorcycle training drills. I like parking lot stuff. I got the idea from Moto Gymkhana and a few other different things, but it's so complicated. You have like 300 cones that you have to navigate. So I decided 10 cones, one design. And so the whole point of it is that, yeah, you're gonna do a lot of tight turns. So it goes from beginner all the way to expert. It just gets even more crazier. And in the booklet, there is a QR code. I already sound like I hate myself, but there's a QR code. So if you want to watch me do it so you know what it looks like, so I'm doing a demo, I have my time, try to beat my time also. There's a digital download, it goes on your phone. So if you have a rock form mount, link in the description. Yeah. But I think this is very important just for that slow speed stuff. I'm working really heavily right now on a new project for the Smart Rider training manual. So if you don't know how to ride, you can start riding in a neighborhood. You get all the way from permit to endorsement and common riding scenarios. And then a big portion, a different module is gonna be what we're talking about today. So it's gonna be fully comprehensive. That's what I'm really excited about. And that's what I'm working on. But these right here, they're a lot of fun. I'm gonna start the Smart Rider games up again, where we're all gonna compete against each other. And there is a free download that you can have, ridingsmart.com. And then you go to the free download. You can have like, 8 drills for free? Just start there. So I don't know. It's hard for me to sell stuff. I just want to watch crashes and like make.
Well, I mean, it's literally what supports us to be able to do these things. So
that is true.
We don't get paid to come out to these things. This is literally how we make it possible. So it's not a. It's for real.
True. All right.
Let's see what we got next here.
Terrible salesman.
All right. So if you have any questions about anything, Q&A time. I know you guys already asked a bunch, but that was our presentation on motorcycle trauma.
So a couple of years ago, I went to a seminar similar to this, and they said if somebody, if you need to remove a helmet in the event of an emergency, have somebody on the front side stabilizing their neck while you hold it.
Yeah. So how we did it was that if I was by myself. And so like that situation, if you had multiple people, and that's when you can direct somebody. It's like, hey, hold his head while I'm pulling it off. So I was pulling it off halfway, and I kind of did the whole underneath thing. That's what I was trying to show. That's pretty hard to do.
If you did do CPR, is there any time or any reason to do respirations as well?
There's different ways of doing it. You can do 30 compressions, 2 breaths. There's like American Heart and a few other different situations. But I personally, whenever I tell somebody, because they're scared, it's like, I don't want to put my mouth on somebody. I don't want to do that. So then they don't do any CPR. And so there's continuous chest compression CPR, basically. So to me, that's what I tell people to do. If you have more knowledge and it's like a best friend, maybe it's your loved one, I don't think you would really care if you put your mouth on them. But there is stuff inside your kits that, you want to talk about that?
So, and also you have 8 minutes of oxygen to your brain when the heart stops. So that's why they started teaching the breathless CPR, where you can just do compressions, because you have about 8 minutes, and they figure, oh, okay, well, EMS will show up by that time. And so they still have oxygen, but that's not always the case. So if you're far away, at some point you're gonna have to start giving compressions, or there's gonna be no oxygenation, and you're gonna just be pumping the oxygenated blood through, which isn't gonna help anything. So in the Pro kits, I actually have a CPR shield. So what you do is this literally goes in their mouth like this, and it has a one-way valve. So that way, any kind of secretions or vomit or anything doesn't go back up into your mouth. So you can blow right in and it's not gonna come back out at you. And then any kind of secretions, it literally creates a whole shield around them, which is pretty cool. So something that makes doing the breaths a little bit less gross. But yeah.
Dealing with like things you add onto the bike, like crash bars, hand guards, sliders, are there certain things where you actually see work better than others in terms of like preventing injury? Or inversely, are there certain things that you put on bikes that actually could increase your risk of injury without really knowing it?
No, that's a good question. I think it comes from a position of what can be on the bike, right? That can prevent more injury. I think for me, honestly, the best thing is your actual riding gear is going to help mitigate some of the injuries. Yeah, having crash bars, I can see like if there's a crash bar, like a big cage and it falls over, it doesn't crush the leg. I think that's kind of where we're going with that. That will help out a lot. But when I think of that, I'm thinking of his boots that he has on right now, crushing his ankles. So if he has good gear, it's going to help mitigate some of that stuff. So I'm always going to preach full gear, everything, and then maybe try to protect the bike. But yeah, I can't think of anything on
my
the bike
take would
itself.
be visibility. Visibility, things that increase visibility.
Yeah, that would work. Use your high beams all the time.
Yeah, yeah.
Yeah, don't break
no, that's
off.
huge.
Yeah.
Yeah.
Yeah, don't buy tourniquets on there either.
Exactly, yeah. One actually really cool thing. These are called Tag Easies. I don't know if you've seen the video on these already. I did bring some with me. So this is something that we're actually, Tremoto is the first company in the entire North America. Actually, the first company outside of India is actually the guy who made this. His name is Deepak. He's a super cool guy. He came to the United States, learned a lot of things, and then started developing secure servers around the whole world. He spent about 8 years building this. It is a medical ID tag that goes on your helmet or your bike, wherever. And underneath this right here, if you were to peel this off, there's a QR code. If you scan it, it will give you my allergies, blood type, emergency contacts, things like that. So they're pretty cool. And you can register each sticker separately. So I did bring some of those too. And it's great if you're by yourself or no one can speak for you. A lot of times in the hospital, we get John Does because we don't know who you are. The wallet flew out, they weren't carrying a wallet, the phone got destroyed. We don't know who that person is, we can't call anybody. So having even something like that where they can scan and now they can call your family, hey, we found this person, are they related to you? They can take care of you better. So, cool. Yeah.
So I went down to a Rebel 500 for fun. Yeah, I had an Indian FTR 1200S, and I enjoyed that one. Before that was a Harley Sportster 1200. It was the Nightster. It was a 2012. I did have a KLR 650 for about 2 months. That was pretty cool. But right now it's the Honda Rebel 500, just so I can show in like these drills and in the videos that I do that even in a beginner bike, you can still do a lot. You don't need to have a 1000 bike. You don't need that. So that's what I have.
And I just sold my K2, so I had a 2002 Gixxer 1000, and I sold that for a 2016 R1. I have an R1 now. Got it tuned. It's pretty nice. All right, anything else? That might be it. Oh.
I've seen some people that when they know their blood type, they'll get like a pad or something, put it on their jacket or something. But I've been by some people that feel that they just don't trust that stuff. They'll actually test your blood.
Yep.
Yeah. So that's pretty much the truth. So it would be a good like confirmation. So like if someone's got it tattooed or they have something like this, it's like, okay, that matches up. But in reality, yes, if it's a trauma situation and you're either going by, some ambulances are actually starting to carry blood, they'll give you just O negative. That's what you're gonna get no matter what, if it's a traumatic situation. But it's just more of like a confirmation type thing. But like the emergency contacts is probably gonna be the biggest help with those. But yeah, you're totally right. Yeah. All right. Oh. Yeah, we're gonna chill here. If you guys want to come up and hang out and talk and check out some of the stuff, absolutely. We're just grateful to be here, and this has been such an amazing experience. So we thank you guys. You are the first university we have ever been to teach. Like this is awesome.
This has been fun. I'm not on the green screen. I'm actually out here, so it's nice.
Yeah. So thank you guys so much for being the first group that's ever allowed us to do this.
Thank you.
Thank you. All right, cool.
That's it.
Cue the music, right?
Yeah, we'll go ahead and play some music.
Yeah, we're good. That's it. So yeah, if you guys want to come down, we'll be hanging out.
If you ever drop your bike, don't buy a kit right now.
So yeah, these, I'll turn my mic off there.